Elizabeth's husband, Prince Philip, has begun his second weekend in hospital in what is now his longest ever stay as he battles an infection. The 99-year-old Duke of Edinburgh was admitted to King Edward VII Hospital in London last Tuesday evening after feeling unwell. Buckingham Palace said last Tuesday that Philip was comfortable and responding to medical help. His son, Prince Edward, also said this week Philip was a lot better but looking forward to getting out, with the royal family who were keeping their fingers crossed. Today, the Duke passed his longest hospital stay as he continues to get treated for the infection for a 12th day. Photos from outside the hospital this morning showed police officers standing guard. In an update on the Duke's health on Tuesday, the palace said the Duke of Edinburgh remains at King Edward VII Hospital, where he is receiving medical attention for an infection. He is comfortable and responding to treatment, but is not expected to leave hospital for several days. In an interview with Sky News, the Duke's youngest son, Prince Edward, who said he had spoken to his father on the phone, revealed the Duke was a little frustrated at remaining in hospital. Talking about his father, Edward said, "He's a lot better, thank you very much indeed, and he's looking forward to getting out, which is the most positive thing, so we keep our fingers crossed." Asked whether Philip, who turns 100 in June, was frustrated to be in hospital, Edward laughed and replied, "Just a bit. I think that it gets to all of us, and then you can only watch the clock so many times, and the walls are only so interesting. We've had some brilliant and lovely messages from all sorts of people, and we really appreciate that, and so does he. I've been passing them on. It's fantastic. Thank you." The Duke of Edinburgh's eldest son, Prince Charles, also made a 200-mile round trip to see him in hospital last week. The Prince of Wales, 72, who is next in line to the throne, appeared in sombre mood after the 30-minute visit with his dad last Saturday. Days after the visit, former Buckingham Palace official Dickie Arbiter claimed Prince Philip may have requested the visit from son Charles as he prepares for him to take over and discuss the future of the royal family. The Queen's former press officer, Dickie Arbiter, who served Her Majesty from 1988 until year 2000, said the visit would have been at Philip's request. Speaking on True Royalty TV's Weekly, the Royal Beat programme, on Saturday morning, Mr Arbiter said the Duke of Edinburgh will have been looking to the future when he is no longer around. He was just saying to Charles, "One day you are going to be the leading man of the family." He continued, Mr Arbiter told the Royal Beat, "I think it was at the request of the Duke that the Prince of Wales visited. To lay the ground. Look, the man is 99. He is in hospital with an infection. My guess is that he will come out, he will walk out, and he will go back to Windsor. But eventually he's going to die. And he was just saying to Charles, one day, you are going to be the leading man of the family." Meanwhile, the Queen is reported to be going through a tough phase of her life, as her steadfast partner, Prince Philip, has been admitted to hospital for several days. The health concerns are also affecting the 94-year-old monarch, who is reportedly leaning on her loved ones for support. The Duke and Duchess of Cambridge, the Duchess of Cornwall, Prince Charles and Princess Beatrice are rallying round Her Majesty in this hour of need. But the Prince of Wales, heir to the throne, is said to have become the monarch's main support amid the crisis as he takes on more responsibilities, US Weekly reported. The publication's source said Prince Charles in particular is making an effort to step up. He is reportedly giving all strength to the Queen and doing his best to keep his mum out of every type of stress. It added that the Queen is the first to admit that he has been her pillar of strength. The claim comes as Buckingham Palace sources confirmed Philip is likely to remain under observation for now.